As more people are focused on the coronavirus, health leaders want to remind parents of some other risks their teens and preteens face during Preteen Vaccine Awareness Week.
Sarah Hammond spoke to a family practitioner who says families shouldn't forget the tetanus, HPV, and meningitis vaccines as well.
Joette Dewey has 3 daughters. They're 15, 12, and 9 years old. And she says she'll do anything to keep them safe, like making sure they get all of their vaccines.
Hearing stories and, throughout, before I even had kids, I just knew that this would be more of an extra protection.
As fears over the coronavirus increase, the Georgia Department of Public Health wants to remind people of other risks teens face. Dr. Dipin Patel says parents need to stay on top of their kids' vaccines.
He says making sure your teen is up to date on their vaccines can help prevent things like the flu, meningitis, HPV, and tetanus.
It's important that all the children are vaccinated. It prevents, so there are a lot of vaccine preventable diseases.
He says they not only prevent those diseases,
but he also prevents the complications like brain damage, some hearing problems from those diseases.
The Centers for Disease Control created this roadmap to tell parents when their children need to get vaccines. They recommend the tetanus, diphtheria, and pertussis shot and the HPV vaccine when children turn 11, but flu vaccines can start as early as 6 months. And Patel says the earlier, the better.
It does prevent the diseases at any point of the age, but definitely early on would be better.
Joette Dewey says her daughters have gotten all of their shots.
We're trying to protect our kids from everything, so.
And she's glad they're staying healthy.
I mean, yeah, once in a while we get the flu or something like that, but they are honestly healthy.
In Warner Robins, Sarah Hammond, 13 WMAZ News.
The Georgia Department of Public Health also says immunizations reduce absences at school and decrease the spread of illnesses at home, in schools, and in the community.